Welcome to the lesson 1 of the module 2. Cough. When it is normal and when it is dangerous. Most people think cough is a small problem. They wait, they ignore, and they self-medicate. But as a doctor, we know something important. Some coughs are harmless and some coughs are warning signs of serious diseases. In this video, I will help you to understand which coughs are usually safe, which coughs need medical attention, and when waiting can be dangerous. What is a cough? Cough is a protective reflex. It helps to clear mucus, dust, and irritants from our airway. Most acute coughs are caused by common cold, viral infection, mild throat irritation. They usually improve within 3 to 5 days. When does cough become a warning sign? According to clinical guidelines, a cough becomes concerning when it does not follow the normal healing pattern. The red flags include cough lasting more than 3 days, worsening instead of improving, cough disturbing our sleep, cough with weakness or breathlessness. We are going to learn some dangerous cough symptoms we should never ignore. In this case, we have to seek medical attention immediately if cough is associated with blood in the sputum, chest pain, high fever, breathlessness at rest, weight loss or night sweats. They may indicate pneumonia, tuberculosis, severe asthma, COPD exacerbation. There are a lot of common myths about cough. It's just allergy. It will settle on its own. Cough syrup is enough. Delaying evaluation is one of the most common reason for complications. ഈ ഒരു കോഴ്സിൻ്റെ മോഡ്യൂൾ 2 ഏവർക്കും സ്വാഗതം. നമ്മുടെ ശ്വസന സിസ്റ്റവുമായി ബന്ധപ്പെട്ട ചില ആരോഗ്യ പ്രശ്നങ്ങളും അവ കാണിക്കുന്ന ചില അപകടകരമായിട്ടുള്ള ലക്ഷണങ്ങളും അവയെ തിരിച്ചറിഞ്ഞിട്ട് അത് മാനേജ് ചെയ്യാൻ വേണ്ടിയുള്ള നടപടികൾ സ്വീകരിക്കാനുള്ള കുറച്ച് കാര്യങ്ങളാണ് ഈ ഒരു മോഡ്യൂളിൽ നമ്മൾ ചർച്ച ചെയ്യാൻ പോകുന്നത്.